For my presentation, I decided to do oppositional defiant disorder, also known as ODD. An overview of the disability. The DSM-5 defines ODD as a recurring pattern of irritable/angry moods, defiant/argumentative behaviors, or vindictiveness that lasts over a period of at least 6 months. What does oppositional behavior look like? Oppositional behavior in children looks like hostility, aggression, spitefulness, negativity, breaking the rules, disobedient towards adult or authority figures. Oppositional defiant disorder is among the most common diagnosed mental health condition in childhood. History of the disorder. The diagnosis of ODD was first listed as a disorder in 1980 in the DSM-3. Many question if ODD was just bad behavior from individuals, while others saw ODD as a less extreme of conduct disorder. In 2013, the ODD diagnosis received several updates. Behavior from oppositional defiant disorder is behavioral and emotional. Diagnosing ODD. Signs of ODD generally begin during the preschool years. Sometimes ODD may develop later, but almost always before the early teens. A child is not likely to see his or her behavior as a problem. They will probably complain about unreasonable demands or blame others for their problems. A child must present specific behavior for more than 6 months and must be caused by psychosis and mood disorder, and the behavior must negatively impact the child's social, academic, or occupational functioning. A professional would likely do a comprehensive psychological evaluation on the student. Characteristics of ODD. Sometimes it is difficult to recognize the difference between a strong-willed or emotional child and one with ODD. To be diagnosed with ODD, a child must present these behaviors for more than 6 months. Angry and irritable moods, vindictiveness, argumentative, and defiant behaviors. Children with ODD often and easily lose their temper. They're easily annoyed by others. They are spiteful. They often argue with adults. They often show defiant behaviors, and they often blame others for his or her mistakes. ODD can vary in severity. It can be mild, moderate, or severe. In a case of a mild diagnosis, a symptom of ODD would occur in one setting, and in a severe situation, symptoms can occur in 3 or more settings. ODD. Contributing causes may be a combination of inherited and environmental factors. Genetics, a child's natural disposition or temperament, and possibly neurobiological differences in the way nerves and the brain function. Environment, problems with parenting that may involve a lack of supervision, inconsistent or harsh discipline, or abuse and neglect. ODD may break down to the nurture versus nature aspect. The impact of the disorder on academic and social domains. Children with ODD may have trouble in school with teachers, staff, students, and other authority figures. Children struggle to make and maintain friendships and relationships. ODD leads to problems such as poor schoolwork and performance, antisocial behavior within the classroom, impulsiveness, anxiety, and learning and communication disorders. Current treatments. The first one is family-based interventions, and that includes parent training, parent-child interaction therapy, and cognitive problem-solving training. Parent training is done by a mental health professional who will come in and help parents develop parenting skills that are more consistent, positive, and less frustrating for you and your child. Parent-child interaction therapy is done by a therapist, and a therapist will coach parents while they interact with their child. And this helps parents learn more strategies to reinforce their child's positive behavior. And lastly, cognitive problem-solving training is a type of therapy that is aimed to help your child identify and change their thought patterns that lead to their behavior problems. The second type of treatment is types of psychotherapy and training for the child. And this is treatment that can last for several months, possibly longer. And the third isn't necessarily a treatment, but medication is not used for ODD unless it is paired up with another mental health disorder. Best practices for the classroom. So 6 ways you could help students with ODD within the classroom is to be calm and consistent, reinforce positive behavior, find out what is going on, create a safe reset space, offer choices, and build connections with the students. So it's important to be calm and consistent because when you're reacting with anger with ODD, it's only going to make a student's behavior worse. So we need to be calm and consistent with these students. Reinforcing positive behavior, reinforcing the behavior that we want within the classroom, finding out what is going on, figuring out what is going on to prevent the defiant behaviors from happening again, really getting to the root of the problem, creating a safe reset space. Every classroom should have a nook, a peaceful corner, maybe a comfortable seat, a spot for the student to take that moment to breathe, get themselves all together and reset. Offering choices, offering the tools of autonomy within the classroom for the students to feel like they have a voice, and then building connections. Building connections will help get to the root of the problem. If a student is having a hard time, having that connection with the student, they are able to express what is going on and they feel more comfortable speaking to that adult.